Hello and welcome to We the People. I'm Gargi Rawat. Today on the show, a very important conversation around women's health. Did you know that according to the World Health Organization, cervical cancer is the second most common cancer among women in India? 99% of all cervical cancers are linked to the human papilloma virus, or HPV as it's more commonly called. Now, there are vaccines to protect us from the human papilloma virus and related diseases, which include cervical cancer. Unfortunately, the level of awareness around these vaccines is extremely low. WHO and the Indian Academy of Pediatrics recommends HPV vaccination for girls as young as 9 years old. But the uptake of the vaccine, however, is very low among children in India and among women. So today we're going to talk about the importance of the vaccine, what parents could and should do to protect their children from HPV-related diseases. It's not just cervical cancer, there's several other diseases that it can cause. Joining us today for this conversation and to create more awareness about this, we're joined by Dr. Meenu Walia, Vice Chairman, Medical Oncology, Max Super Speciality Hospitals, Noida, Dr. Arun Vadva, Pediatrician. Also joining us is Dr. Tanaya Narendra, also known as Dr. Cuterus, or doctor, author and educator. Thank you so much for being with us today. Dr. Garima Malhotra, who goes by the name of the Doctor Mom on Instagram and posts regularly about children's health and health related issues. So thank you so much all for joining us today on the program to talk more about what can be done regarding HPV and the cervical prevention of cervical cancer. And Dr. Walia, I'd like to start with you first. If you could just explain to us what exactly is HPV and also what is cervical cancer, how is it caused?
So HPV, the word stands for human papilloma virus. So it is the type of virus, and it is something like this. A viral infection is very, very common. The infection rate is very, very common. And now it is not one virus like what we learned from during our COVID days, what people will remember. There are many variants of the virus. So human papilloma virus also has many variants of the virus. There are almost 100 odd variants of human papilloma virus. But what is important is to know that there are some variants which we say are very virulent, and there is a higher risk. I mean, they can actually cause cancer. So many human papilloma virus infections can be asymptomatic also, it can clear off on its own. But some of these infections can stay, especially with the more pathogenic strains, something like the strain 16 and 18. This is considered to be one of those very highly pathogenic strains.
So many of them can remain harmless and one can live with it, and it can go away by itself as well.
Yeah, but some of these strains, especially like I said, the strain 16 and 18, it can stay on and it will have a propensity, it will have a tendency to cause cancer. And one of the common cancers, apart from other cancers, one of the very common cancers that it causes is cervical cancer, which in our country, the burden of cervical cancer is so high that we contribute to almost 1/4 the burden of the cancer in the cervical cancer in the world, a very, very high number. So something like cancer, which is entirely related to a type of virus. So what this virus does, it causes certain changes in the cells, it causes certain mutations, some changes in the cell. These changes in the cell convert them into being carcinogenic, being into cancer cells, and once cancer develops, then we know that as the cancer increases, the stage increases, it will spread to other parts of the body and it can actually be life-threatening also.
And what is quite astounding to know is it's completely preventable because you can get the vaccine. Dr. Vadva, if you can, talk about how much awareness have you found among parents who come to you? Do they come with questions? If you could talk a bit about that.
So the parents' awareness has definitely increased. We've been having this vaccine for almost 16, 17 years now. And earlier we used to really struggle hard telling them what is, and people used to think cervical cancer means cancer of the neck. So now the things have changed, people are aware, it's not so difficult to tell them, and they are now ready to take also. So times have changed.
Definitely, but do you find yourself having to tell many parents and educate them as well?
But the number of parents who need counseling education has become much less now. People are aware, so there is awareness in the society, but still they are hesitant in taking the vaccine because of various reasons. So they come and clear their doubts and we tell them, assure them that it's a good vaccine. It's like any other vaccine. It's like a kill virus. So all other vaccines which we use like hepatitis B, A, they're also kill viruses. So it's the same way. People sometimes they feel it's got some hormones, they'll disrupt the hormones, the periods may be delayed, something may happen, but we have to tell them that's like all other vaccines. It's a kill virus, doesn't cause any harm, it's all good.
Absolutely, and that's why we need to create more awareness about this. Dr. Narendra, if you can also come in here and talk a bit more about HPV and the complications it can cause, what it means for women reproductive health.
Thanks so much for having me. This is a topic I'm very passionate about, and I've been working on creating awareness about this for about 4 years now, simply because this is the only cancer in the world that is preventable with a vaccine. We have all of these big news stories about protect yourself from cancer, cure cancer this way, miracle cure for cancer. It's not a cure yet, but this is literally the only option we have for a cancer that has the global burden for India is very, very high. So HPV, like the others have mentioned, is a group of viruses. It's a family, and there's many different types, out of which some are known to cause cancer in humans. And it's not just the cancer of the cervix. So like Dr. Vajra said, cervix means the neck. And here cervix means the neck of the uterus. So it's the bottom part of the uterus. And aside from causing cancer of the cervix, HPV is also linked with cancers of the back of the throat. So the oropharynx, what we call. It's also linked with cancer of the penis, of the anus. So anogenital cancers, oropharyngeal cancers, vulval cancers, vaginal cancers. A very significant proportion of these cancers is caused by the HPV virus. We now understand that well enough. And we have a beautiful way of protecting ourselves from cervical cancer. There's two ways of protecting yourself. One is primary prevention, other secondary prevention. So you can get the vaccination, which protects you from the virus itself, which is implicated in more than 90% of all cervical cancer cases. And you can also get something called a pap smear every few years once you're of a certain age. Along with these two, coupling these two things together, you can protect yourself from the second most common cancer in urban Indian women. Why not do it?
No, absolutely. And, if we... Yes, sure.
Along with cancer, forget another thing, that the vaccine also protects you against genital warts. So 1% of the whole population in India statistically has genital warts, which tend to be recurrent and keep coming back, and they're embarrassing. So the vaccine protects you. It has 2 strains in it, 6 and 11, which protects you against the warts also.
Okay, that's important to know. Dr. Valia?
To add on to what Sir
yes,
said.
And if you can also talk about, the long-term impact of HPV and cervical cancer.
So again, just to add on where he left. So apart from the cervical cancer and the genital warts, most people think that vaccine is only for cervical cancer. So not only cervical cancer, there are many other cancers which are linked to human papilloma virus. We talk more about cervical cancer being much more common. So it can also prevent, protect us against, say, vaginal cancer, vulval cancer, penile cancers also, and also some of the oropharyngeal cancers, which are also known to be HPV linked.
Anal cancer also.
Anal cancers also.
So that's why we start now giving it to boys also, because anal cancer, penile cancer, oral cancer happens in boys too, even the warts. So even men need the vaccine now.
No, absolutely. And I also believe because they can be carriers of HPV, yes, and then pass it on to their partners. So how common is that in terms of parents knowing that their sons should get the vaccine?
So for boys, the awareness is gradually now building up. What we had for girls 10 years ago.
Yes.
And they are surprised because they feel cervical cancer means ladies. Cervix is not there in boys. Why do you want it? So we have to tell them that there are 3 cancers, anal, oral and penile, which are prevented in boys, plus the genital warts, and plus transmission of the virus to their partners. So it's a community vaccine which, if everybody takes, the virus transmission will not happen and the cancer incidence in the community will go down.
So definitely it's something that parents of both sexes need to be aware of.
So it's a gender neutral vaccine, everybody is protected, the transmission, like herd effect, the community virus transmission goes down, so even the girls, the ladies also will not suffer from cancer.
No, absolutely. Dr. Malhotra, if you can, since you interact a lot with parents, it's all about creating a lot of awareness. In the course of your work, what sort of fallacies have you found or concerns that parents have? Do they speak about this? Are they concerned about the vaccine?
I think when a few of the mothers, like my community is all about new mothers, and they were not even aware. They got aware about cervical cancer and they need to get vaccination. That's how the awareness is increasing, and the concerns which they usually have is they are still not confident about either we should get it done or we should not get it done. So I think awareness is what we through Instagram or through social media we can create more and
shows
more
like this, of course.
Yes, so the shows like this, we can create more and more awareness about the same topic, and bringing good speakers like
That's
ma'am.
right, Dr. Valia. So just to, it's preventable if you get the vaccine. If you can tell us about cervical cancer itself, then it's a long treatment. It depends on what stage you catch it at, and it's completely preventable. So it's important if you could talk a bit about that.
So cervical cancer, as I said, the burden of cervical cancer is huge in our country. So globally, India itself is contributing to almost 25% of the cervical cancer worldwide. And if we look at the mortality, then few years back we had the government figures that would say every 8 minutes a woman in India dies because of cervical cancer. So that is the gravity of the situation. And the sad part is today, I mean, this is a cancer, sad or the good part, whatever you say, which is, as you said, almost 100% preventable. So if not preventable, it can be detected. So cervical cancer is not a cancer that actually develops overnight. I mean, it is not that today you are okay and after a week you will be detected to have cervical cancer. It generally has a long latent period, and that long latent period easily runs into months and years. So when the cells in the cervix, as somebody aptly put, is the lower portion of the uterus, the neck of the uterus, and the cells in the cervix, they have certain changes and they get converted into cancer cells, and there is a latent period. Latent period is that over a period of time these cells will get converted into cancer, which will run into months to years, and so we have phases for that when these cancer cells will develop. In today's state, there are screening methods also that we have been having for many years. So regular screening which we would promote for women, for ladies, and that would include PAPS testing, which is a very simple test that can be done in any gynecologist's chamber. And another what we have nowadays is what we say PAP and a HPV co-testing. So that is something what we say is you can do a test, it is a screening test. All the general, I mean, it is really prescribed for women who are at risk for survival. I mean, all the women who should get these tests regularly. And what these tests do is you detect cancer early. You can actually detect cancer way beyond the cells. You can detect it even in stage 0. So we say CIN, I mean, this is a different stage, is CIN 1, 2, 3. So as early as stage 0 of cervical cancer, you can detect this cancer, and where it is almost again 100%, almost 100% curable. But now, since we have the vaccination, and vaccination is something you are actually eliminating the root cause. You are eliminating that, you are acting against that human papilloma virus which can cause cancer. So vaccination at the right age, and that is why the right age we say is, the right age is actually the pre-teens. I mean, much before the exposure to the virus happens. So that is the right age where we should give the vaccination, and there is something called as catch-up age or catch-up vaccination. If we have missed that age, then it can still be given like in the teenager group, say 15 till 26 years of age. And now we have data that it is found to be safe till 45 years of age also. But the efficacy will be the highest before the exposure happens. Right. And that is why the recommended age is somewhere between 9 to 12 years.
All right, Dr. Ratana, if I can get you back here, on this, what are the kind of doubts that parents have? There's all this misconceptions around menstruation. It could impact that in some way. So, and I was happy to hear from Dr. Vadva that that more and more parents are coming forward and taking the vaccine. But if you could tell us about these kind of misconceptions.
One of the primary fears that people have is because HPV is a virus that spreads via sexual contact. People have extrapolated from this that if you get vaccinated, it will mean that you're encouraging, sexual activity for young people. So because of that, there's a lot of misconceptions that people have developed over the years, including false ideas like getting the HPV vaccine will result in infertility, when in fact this is a vaccine that will protect your fertility. because it is protecting you from viruses, from cancers of the reproductive tract. So people worry about this. People also worry about life-threatening side effects. People worry about things that have never happened but have been untruly linked to the virus. With all of that said, it is important to remember this is one of the most tested vaccines in the world. We have millions and millions of people's worth of data where we have seen that the side effects have been mostly simple things like pain in the arm or redness or maybe say a slight fever the next day. Whereas the serious side effects that people report just haven't been linked to this vaccine yet. And it is massively well tested and it has an excellent safety profile with very, very significant results in terms of protecting you from, again, the most common cancer in rural Indian women, the second most common cancer in urban Indian women. So we strongly encourage people to take it. And if you do have doubts about this vaccine, especially with regards to the misinformation you might see on social media, it is a very good idea to speak to your doctor about it, because they can explain to you how this vaccine was tested, what is the safety profile we have on it, what is the kind of data we have on it, and how a lot of this is unfortunate misinformation.
Dr. Vasu, you can tell us what are the different types of HPV vaccines?
So we have actually 3 broad types. One has just 2 strains in it, the 1618, which is not available in India now. It did not have the 611 strains which cause warts. And then the other 2 which we have now are the 4-valent, the quadrivalent, and the nonavalent, the 9-valent. So both of them have 2 strains of warts, 611, and also have 2 strains of the cancer causing in the quadrivalent, and one has 7 strains against the cancer. So a better vaccine would of course be the nonavalent vaccine, which has 9 strains. It gives you very good protection to the tune of 98.4, 98.6%. And if you use the quadrivalent, it gives you protection around 80 to 83%. So broadly, if you say 2 vaccines or 4 strains and the 1 vaccine with 9 strains, so we have 3 vaccines which are there in the market.
All right. Well,
the 2-strain vaccine is not available now.
Okay.
It's withdrawn.
Okay. And all this
when you
information.
have a better vaccine, the older ones will be phased out. Eventually, I think the 4 one will also be phased out soon.
All right. Well, I'd like to take this to the audience as well, and we have, a survivor of cervical cancer. अगर आप बता सकते हैं आपका नाम क्या है और आपका एक्सपीरियंस के बारे में?
मेरा नाम परमजीत कौर है। मैं सर्वाइकल कैंसर सर्वाइवर हूँ। मेरे को 2019 में डिटेक्ट हुआ था, पर उससे पहले मेरे को कोई सिम्टम्स नहीं थे, कभी कोई प्रॉब्लम नहीं हुई, कोई मतलब फीवर नहीं, कुछ भी नहीं था। अचानक से मुझे एक दिन हैवी ब्लीडिंग हुई। नॉर्मल ब्लीडिंग भी मेरे को डे टू डे पूरे जैसे पहले था वैसे ही था। फर्स्ट टाइम मेरे को हैवी ब्लीडिंग हुई जिसमें मैं फेंट हो गई थी। तो नेक्स्ट टाइम मैं एक गैप आ गया, एक महीने में मैं पीरियड्स नहीं हुई। तो जनवरी में नॉर्मल रहा, फरवरी में फिर मेरे को हैवी ब्लीडिंग होने की वजह से मुझे डॉक्टर के पास गई मैं। तो उन्होंने मुझे कहा कि आपको बायोप्सी करना पड़ेगा। तो मुझे लगा कि भाई अगर मेरे को मेनोपॉज है तो बायोप्सी इतनी जल्दी, तो मैंने कहा मैं घर पे बात करके फिर बताती हूँ। मैं घर पे आई तो हम लोगों ने डिसीज़न लिया कि हम लोग हॉस्पिटल जाएंगे तो चेक करवाते हैं। तो उन्होंने मेरे को एडमिट कर लिया क्योंकि मेरा HB लेवल बहुत डाउन चला गया था, 5 ग्राम रह गया था।
तो आपको पूरा जो ट्रीटमेंट रेडिएशन
हाँ जी 30 रेडिएशन
वुड हैव बीन प्रिवेंटेबल।
उसके साथ ही 5 मेरी कीमो साइकिल चली थी
जी,
एंड उसके बाद मेरी 4 मतलब इंटरनल रेडिएशन चली थी।
और आपको सर्विकल कैंसर के बारे में अवेयरनेस थी इससे पहले?
पहले हाँ पता था, बट मेरे को ये नहीं था कि मुझे हो सकता है, क्योंकि मैं बहुत एक्टिव थी। मैं शॉप पे जाती थी, अपना काम देखती थी, सब कुछ करती थी, मतलब मुझे ऐसा लगा ही नहीं था। इवन मैंने अपनी बेटी की मैरिज की थी 2015 में, तो मैं बिल्कुल एक्टिव थी और मैं कोई कह ही नहीं सकता था कि मुझे खुद पे भी विश्वास नहीं हुआ। मुझे लगा शायद रिपोर्ट गलत हो सकती है, मुझे हो नहीं सकता।
कैंसर पेशेंट्स फील हाउ कुड इट हैव बीन मी, व्हाई डिड इट हैपन। और अब हम ये जो प्रोग्राम कर रहे हैं कि एक वैक्सीन है जिससे प्रिवेंट हो सकता है, तो इसके बारे में आपको क्या कहना है?
हाँ, तो ये तो ज़रूर सबको लगवानी चाहिए। मैं सबसे पहले मैंने अपनी बेटी को लगवाई, अपनी फैमिली में जितने मेरे रिलेटिव्स हैं सबको मैंने बोला कि आप लोग को लगवानी चाहिए, और हमारी फैमिली में सबने ही ये वैक्सीनेशन करवाया है। क्योंकि अगर इसके कोई सिम्टम्स ही नहीं है, वैसे भी मेरे को लगता है कि किसी भी कैंसर के कोई सिम्टम्स एकदम से पता नहीं चलते। अचानक ही पता लगता है, तो उससे अगर जो चीज़ हमें वैक्सीनेशन में अवेलेबल है हमें वो लेनी चाहिए, जिससे हम बच सकते हैं, जिससे हम ठीक हो सकते हैं, क्यों नहीं।
एब्सोल्युटली।
और मुझे एक चीज़ और भी समझ में नहीं आती, हाँ, कि इसमें कई बार क्या लगता है कि सर्वाइकल कैंसर, मुझसे सब लोग पूछते हैं तुम्हें कैसे पता लगा, कि तुम्हें पहले क्यों नहीं पता लगा। तो मैं सही में कहती हूँ, मुझे पहले कुछ नहीं पता लगा। जैसे नॉर्मली 5 डेज़ पीरियड्स आते हैं, मेरे को भी आते थे 5 डेज़ एवरी डे, मतलब एवरी मंथ उसी साइकिल पे आते थे, आगे पीछे भी नहीं, कभी चेंज भी नहीं हुआ। एंड हाँ, क्लॉट्स कई बार आते थे छोटे छोटे, तो उसको नॉर्मल सब लोग कहते थे, नॉर्मल होता है।
आपने पढ़ा तो आपको
बाद में पता चला कि वो मुझे पहले दिखाना चाहिए था। तो अब मैं सबको बोलती हूँ कि किसी चीज़ को लाइटली मत लो, अगर जो पहले ठीक हो सकता है तो उसको पहले कर लो। ठीक तो खैर मैं भी हो गई हूँ, और मुझे पता है अभी मैं बहुत लंबा चलने वाली हूँ।
Happy to see that you're fine, and thank you so much for sharing your experience. Women take their health last. They'll put off going to the doctor. अगर कुछ हो भी रहा है, they'll say okay, maybe first I want to take care of my child, my son, my daughter, my husband, my falana, this, that, and the other. And very often we don't prioritize our own health. So if you can talk a bit about that and the need for this regular screening, as you said.
But I'm so glad we are talking about screening, because it is such a good, easy to use and cost effective tool for reducing the overall burden of cervical cancer and for getting earlier diagnosis. And as Paramjit ji mentioned, she didn't have any symptoms. So one of the most bizarre things about cervical cancer is that you don't get any symptoms until it's really quite late. And because of that, a lot of people get diagnosed when things have already gone very advanced, which is why screening is such an important and useful and simple and cheap tool. It doesn't cost a lot of money. In a lot of government hospitals, you might be even able to get it for free. And I don't know a lot of women in India who have really gotten screened as a routine practice. So when I turned 25, that's when in the NHS they recommend getting your screening. When I turned 25, I was living in England at that time, and they followed up every single week with me that, come and get your smear. And that was such a shocking thing for me, because even as a doctor, even as the daughter of a gynecologist, I had not heard this kind of, I suppose, medical pressure to get screened. But it was such a useful tool. And what they've seen in the UK is that in the past 10 years, when they've had a lot of regular vaccination, not just for young women, but also for young men. So school-going kids between the ages of 9 to 13 are vaccinated routinely. They have seen a 90% reduction in cervical cancer. This is not a normal number. This is a magical number when it comes to medicine. This is a magical number when it comes to cancer. And they saw a 90% reduction just with good screening, regular screening, and vaccinating everybody. So this is something we really do need to focus on. We really do need more of a push to get people to get their screening done. If you're between the ages of 21 to 65, you should get screened every 3 years. And if you can get your screening done with an HPV test, you should get it every 5 years. It is, with the HPV test, it's a little bit more expensive, but even if you're not getting that, even if you're getting just the pap smear itself, it can be wonderful.
Right, no, absolutely. And awareness, Dr. Walia, you're an oncologist, and obviously, as we keep emphasizing here, prevention is better than actually going, especially cancer treatment, as we know, it can be very hard on your body. If you can talk a bit more about that, and also about the symptoms, because as Paramji shared here with us, she said there were no symptoms till she experienced that heavy bleeding. So that's the issue with most cancers. As you said, regular screening is a way of preventing it.
So before I answer your question, I think I'll take on where she left.
Sure.
That is the major difference between the Western world and this part of the world. What we say is, it is not that we have more number of cancers. No, the number of cancers is much more in the Western world. Major difference is, majority of the cancers which they detect, they detect is the early stage cancer, stage 1, stage 0 cancer, even pre-cancers, they are detecting a lot. She just now exemplified because there were regular phone calls. There is a lot of focus on the screening, and screening is what? Screening is picking up cancer even before the symptoms develop. So, if you really want to pick up cancer before the symptoms develop, that is a very, very like powerful tool. And with screening mammography, with screening tests only, they have actually brought down the mortality of these cancers a lot, because they are being picked up at an earlier stage.
Absolutely, yes.
The next question you asked is
about HPV as well, and if you could tell us, we've talked about how the vaccine is a way of preventing it, but also the impact that it has.
You also talked about, I think and you wanted to know about the symptoms of cancer.
Yes, because
and how
she just spoke about how she had no idea of the symptoms.
So, the problem with cancer is not one disease. When we talk of cancers, we are actually talking about many different cancers. Like it can be cancer, I mean it is named about from where it starts, although in the advanced stages it will probably involve all the organs of the body. So, if the cancer starts from your breast, it is known as breast cancer. If those cells are starting from the cervix, it is known as cervical cancer. If the cells are starting from kidney, we will say kidney cancer. And the problem is, not all cancers will have the same symptoms. And like breast cancer, the symptoms will be entirely different than a cancer of the cervix. Similarly, the cancer of the kidney will have different symptoms. The head and neck cancer, a mouth cancer will have different symptoms. And another important thing is, many of these symptoms are very much like, it is not that a symptom is unique of cancer. If this is there, it is cancer. No. Many of these symptoms are which can happen in n number of other diseases also, much more common diseases also, and that is the reason majority of the times these symptoms are missed by ladies, by even.
I know one of symptoms is like exhaustion. I'm like, we're always exhausted after the age of 30. I think you kids will know right now, but after 30 it is constantly exhausted.
Just feeling tired.
Yes.
So, feeling tired can be because your hemoglobin is going down. Your hemoglobin can be going down just because you are not eating properly, you are not taking enough iron or B12 in the diet, but your hemoglobin can also go down with something as sinister as cancer, something like cervical cancer. If you are actually bleeding a lot during your periods, your hemoglobin will go down. Or if you are having another cancer which we know as a multiple myeloma, a cancer of the bones, the RBCs are not, I mean again the hemoglobin goes down, and people do present with anemia, and you frequently find that they have been for a very, very long time, they are just taking those iron pills and just mocking those pills, thinking that is anemia, and rather than going to a proper setup and getting the checkup done. So, we have a whole list of, again, cough, a very common symptom, can be there in as little as, it can be a seasonal cough, it can be with bronchitis, it can be something like tuberculosis, which is very common in our country, but it can also be cancer. So, anything which is abnormal, any symptom which abnormal and it persists more than 2 to 3 weeks, I will always recommend at least go to your physician, go to your personal physician, your family physician, and do report to the symptoms, and do learn about screening. There are a lot of screening tests available, very simple screening tests which normal people should do, and they can actually get with these screening tests, they can actually pick up cancer early.
Right. Dr. Malhotra, if you can add to that in terms of your interactions with parents and parents of young children, and your message to them, because we've just heard about how preventable this cancer is, and young girls and boys, that's another point that we must raise, that boys too can get vaccinated.
So, first of all, I want to add to the ma'am that there are now home kits available for pap smear, and I think they are, even if you are not going to the doctor, you can get that home screening done at home, and you can get to know the early detection of cancer. When it comes to interaction with the parents, now no doubt about that, awareness is increasing day by day of HPV vaccine, and about this also. Simultaneously, a lot of suspicion or a lot of doubts and are also related to that. But as and when we are growing and awareness is growing through different medias and through authentic medias, as a lot of doctors these days are creating content, like Dr. Kutras is creating content and awareness on this. I think awareness is increasing day by day, and people are getting more aware, parents are getting more aware of the same.
All right,
Yeah.
well, that's an important conversation, and as we said, cervical cancer is completely preventable if one gets the vaccine, and one can get the vaccine starting from the age of 9, and both boys and girls should get it. We'll slip into a short break, a lot more to talk about on the other side. We're going to open up this conversation to our young audience as well. If they have any questions for the doctors, do stay with us. Welcome back. We've been having a very important conversation here on We the People. We've been talking about cervical cancer and HPV and how it's completely preventable if one gets vaccinated at a young age from 9 onwards till you're in your adolescent years as well. And prevention is always better than cure. The purpose is to raise awareness about this issue as well and to remove any misconceptions, as we realize a lot of people have, a lot of parents have, regarding the vaccine and how it can protect your children as they go into adulthood. Well, before the break, we heard from all the experts about cervical cancer, the HPV vaccine, what HPV itself is. But now we want to open it up to the young people here today in our audiences and also hear from them what doubts they have, any questions that they have. First and foremost, I'd like to ask who all have been vaccinated. Who has got the HPV vaccine here? Raise your hand. All right, so one here and nobody on this side. Well, that just shows you the kind of awareness there is and how, again, this is the second most common cancer among women in India, and how there's a need to, get the vaccine so you can completely prevent, further complications, as one all knows about cancer. I think there isn't a family that's unaffected.
In a metro heart of the country and educated group. And you can understand the situation in the villages, how much they must be knowing.
Yeah.
I mean, that's a far way to go.
Tier 2, Tier 3 city must not be knowing also about all this.
How many ladies have got their children vaccinated?
Well, we know you have got them vaccinated because you shared your experience before this. G.
I'd got my sons vaccinated 5 years ago, before it came for boys in India.
Wonderful. And that's the other point that we want to make in this program, that for boys as well. But yes, ma'am, that's a very important point. Here we are in the national capital, and only one person in my audience has taken the vaccine.
जैसे वैक्सीनेशन का बोला, मैंने मेरी बेटी ने करवाया हुआ है, उसके 2 बच्चे हैं. सेकंड डिलीवरी के बाद उसको पीरियड्स बहुत ज़्यादा हैवी रहे, मतलब 2 वीक्स 3 वीक्स चलता था. तो हम लोगों ने फिर डॉक्टर को दिखाया, पैप स्मेयर बिल्कुल क्लियर आया, सब कुछ ठीक था. देन उन्होंने सिस्ट वगैरह कोई प्रॉब्लम थी जिसकी वजह से वो आगे जाके दिक्कत कर सकते थे. तो उसके बाद क्या मतलब अभी उसको पैप स्मेयर दोबारा करवाना चाहिए?
In spite of getting vaccinated, in today's state, we do recommend regular screening to still continue. So that doesn't mean that she must have also got vaccinated quite late, I guess. But even today, when we say if you have got vaccinated also, regular screening for cervical cancer should continue.
All right. Dr. Vada, I wanted to also ask, because you said if you got the vaccine late, if you get the vaccine early on, does one get a booster like you get in other vaccines?
So as of now, boosters are not recommended. Once you take the vaccine, it works almost lifelong. And the best time to take the vaccine will be 9 to 13 years, before the onset of sexual debut. Not only that, intercourse is important, even skin to skin contact can spread. So 9 to 13 years, and since it's a vaccine, it's prevention. And here is early detection. So before the virus actually comes in, best time to take would be 9 to 13 years before the virus enters. And more importantly, the prevention happens, and the antibody levels are best when you take at this age. The antibody levels are almost 2 times more if you take at 9 to 13 years, if you compare it with older people. And higher antibody levels would mean longer lasting, so they last longer. And also for you, if you take at this age, only 2 doses are required. If you take the doses before the 15th birthday, and it's an expensive vaccine, so after the 15th birthday, you'll need 3 doses. You save on 1 dose also.
So that's an important
So that's
point
for you,
make.
but otherwise medically, the levels are better, levels are higher, they last longer. And actually it's prevention, so prevention means before the virus comes, you have to take the vaccine. Once the virus enters, it will not help you. So it's not a therapeutic vaccine.
Right. Dr. Tanaya, I saw you nodding there. If you want to add anything, and I'll open it up for questions as well.
Yeah, like Doctor said, the earlier you get it, the better it is. 9 to 15 are our ideal ages, and you don't need to be sexually active, quote unquote, to get the vaccine.
Right. And the young girl who's had the vaccine, if you could, talk about that. When did you get it?
My name is Kavisha. I just wanted to ask if there Are there any health conditions because of which the HPV vaccine should be prevented?
I mean, you cannot give the vaccine.
Yeah, are there any health conditions?
No, unless you have very high fever, you're suffering from a disease, then you don't take it. Postpone it for a couple of days. Once you're all right, then take. Otherwise, there's no
Any
contraindication.
specific disease?
No. And you don't have to get yourself tested or a pap smear done before you take the vaccine.
Okay.
Just
Right,
go and
so-
take like any other vaccine.
Thank you,
And
sir.
from 9 years onwards, any questions here? Yes, go
Hello,
ahead.
ma'am. Hello, sir. I am Arshit. My question is this: that is there any booster dose required for
No,
the
as of
vaccination?
now it's not required. So
What were
whatever
the side
mathematical
effects?
modeling they've done, it protects you almost lifelong.
And sir, what were the side effects?
No side effects, only those local side effects of local
It's
pain,
totally safe
little
for
feverish
us.
feeling for a day, maximum, that's it.
Sure. Sir.
Not
Thank you, sir.
everybody has it, only a few people will have it.
Thank you, sir.
So what we say, no booster dose, but what we say is a catch-up vaccination. If you have missed the bus that you have already crossed 15 years, then you can still get vaccinated and get the same protection. You get 3 doses of the vaccine instead
Right.
of 2 as already.
And
said.
men should also, we had a question, if you can pass the mic.
I'm Sohana. I have a question as in like children like us, do we need to follow any particular lifestyle or a specific dietary habits that will, prevent us from catching this quick or something?
No junk food, have lots of fruits, vegetables, exercise and sleep well.
Yeah. Homegrown food only.
I think so. There is
And
Homegrown food
concern.
would be the best.
I guess there is some concern among young people, and about how this gets caused. So I mean, Dr. Walia, if you
All
can
these
speak
junk
more
food and all
about.
are.
So I think this is a very, very important question. All these dietary habits probably will protect you from cervical cancer or not. It's another thing altogether. But yes, because in today's date, majority of the problems which the world is facing is all related to the lifestyle. So especially if you start with the right lifestyle at the right age, that will be very important. So as Sir said, stay away from the junk food, have a balanced diet, healthy balanced diet, and being more physically active. Nowadays we are the children are especially going away. I mean, reduce your screen time, be open, be outside, be outdoors more, and be physically active, away from junk food and a healthy lifestyle.
So not only
That will-
cancers, so
yeah.
many non-communicable diseases
So
like
many other
diabetes,
diseases.
weight gain, PCOD, all that also will be prevented by a healthy lifestyle.
Right, and I do hope you young people, after hearing about all this, you're going to go ahead and get this vaccine and demand it. Dr. Tanaya, yes, go ahead.
Just to add one thing, smoking significantly ups your risk of getting cervical cancer. So please don't smoke. It is the single best decision you can take for your health overall. But also with respect to cervical cancer, it increases your risk of actually the HPV virus staying in your body, your immune system not naturally clearing it, and you having a persistent infection that can eventually develop into cancer.
All right, important point there. And Dr. Malhotra, if you just like to add at the end, clearly creating awareness is very important, and be it through influencers, through social media, through news channels like ours, there's a need for people to take care of their health. And I think what we've learned is screening, and of course prevention is the best cure.
I think we people need regular reminders, which is very, very important. And as an influencer, it's our job also, it's our duty also to regularly remind parents about that you need to get your child HPV vaccinated. They should follow a healthy lifestyle, no junk food, go out as ma'am said. It's very, very important. Home cooked food is the best food, and these days I think it has reduced to a number of time. And creating daily awareness on a regular basis will do wonders. And I think for government it is very important, like kids बच्चों की vaccine free में it's available at government hospitals. I think this should also be available at a very low cost or freely when government runs such kind of campaigns. I think it would be great helpful.
Right. Well, we're at the end of the show, and Dr. Vadva, if you could just wrap it up for us, the message that we're trying to put out there to get the vaccine and get it early.
Yeah, get it early is the most important thing. Don't think that cervical cancer is a disease of older age groups. We'll wait till then. The virus enters now. The virus causes cancer 35 years later. So you have to take the vaccine now. And if you've actually missed the bus, do take the vaccine still. And after taking the vaccine, also do regular screening as advised. And if you have any doubts, I think most importantly, talk to your doctor, especially a gynecologist or a pediatrician, not other forms of medicine. And if you have any doubts, read authentic places like WHO, CDC guidelines, not individual blogs, or follow people who have their own opinions. So talk to an authentic person to decide whether you need to take the vaccine.
Go to your doctor and consult them. And if you're a parent, go to your doctor right now and consult them and get your child this HPV vaccine.
About the vaccine, yes.
All right, well, that's the note we'd like to end this show on. So it's very important to take care of your health. We've just heard all about, cervical cancer as well as HPV, and it's clearly very important. This is a cancer that's completely preventable if one gets the vaccine, and the earlier, the better. Thanks so much for watching. Thanks so much, doctors, for being here, and thank you all, audience, for being here. Thanks for watching. Goodbye.